Thank you.
Okay.
While it is difficult to diagnose bipolar disorder in children because the symptoms may resemble other illnesses, early intervention and treatment is the best possible alternative to give children the full potential to succeed and minimize the effects that the illness may have. What is bipolar disorder? Bipolar disorder is a mental disorder causing mood swings. There are 4 different diagnoses of types of bipolar. Bipolar 1 shows episodes of mania and depression. Mania is a feeling unstoppable but will spiral downward quickly. Symptoms include sleeping very little but with very much energy, talking rapidly, racy jumpy thoughts, and in severe cases, delusions or hallucinations. Bipolar 2 are episodes of hypomania between recurring depression periods. Hypomania is a less severe form of mania. They live day to day but can turn into mania. Cyclothymia is a less severe form of bipolar disorder but shows definite mood swings. And bipolar NOS, standing for not otherwise specified, is the catch-all category for bipolar disorder, where a patient may not fit into one of the other categories. Depression shows symptoms of fatigue, loss of energy, weight loss, and appetite changes, and loss of interest in once enjoyed activities. Severe cases even may cause thoughts of death or suicide. In the mixed state, they show signs of both mania and depression, and there's a higher risk of suicide. Symptoms of both mania and depression exist. There are 3 causes of bipolar disorder: genetic, biochemical, and environmental. Genetic is not down to one gene, because if one gene decided if you were bipolar or not, identical twins would both have bipolar disorder because they have the same genetic makeup. However, of siblings, if one twin has bipolar disorder, the other twin has a higher chance of getting bipolar disorder than a regular sibling. Biochemical, there's 3 chemicals that the brain produces that have been triggered to be related to bipolar disorder. Serotonin, the main agent controlling the state of mind and consciousness. Norepinephrine, secreted from the adrenal glands and nerve endings in the brain, and it's related to the fight or flight hormone. And dopamine, which plays many roles. It's reduced in depression and increased in mania. And the 3rd cause to bipolar disorder is environmental. We call these triggers because they may trigger an episode. Life events and seasonal changes are just 2 examples of triggers. Mania is usually present in the summer, where depression is present in the spring, fall, and winter. Other diagnoses are common in symptoms for children that have bipolar disorder, but because they are rapidly changing and can last hours to days, they get diagnosed with other things such as ADHD, Tourette syndrome, OCD. Adolescents have disorders diagnosed as schizophrenia, post-traumatic stress disorder, and borderline personality disorder. Ways to treat bipolar disorder is going to be medication. They take trial and error periods, and you do need to be consistent while taking the medication. Not all medicines will work with every person. Getting educated about bipolar disorder and taking therapy or counseling sessions alone as well as in a group setting with your family will help also to treat bipolar disorder. And good nutrition and regular sleep habits help to control bipolar disorder. To continue your education, some needs need to be accommodated. Class size, one-on-one assistance, and access to bathrooms, water fountains, and a safe place unlimited. So therefore you have a safe place to run if you feel you need to. Day-to-day education will vary due to the severity, weather, and medications. Therefore, consistency gives stable lifestyle to maintain a normal and successful lifestyle. Are there any questions?
Is it more common for children to have one type of bipolar disorder over another?
No, because they can show different symptoms and signs. So they could be classified as in bipolar 1 to cyclothymia or NOS. It just depends on what their symptoms are and whether they've got a more severe form of mania or depression. Any other questions?
Is bipolar disorder more diagnosed in children or in teens?
Research shows that it's been more diagnosed in teens because children are usually diagnosed with a different diagnosis such as ADHD, Tourette syndrome, and OCD, as well as schizophrenia and personality disorders. Thank you.